Hello, and welcome to the Office of Emergency Medical Services Education Program Update webinar. I am Charles Souchere. I'm the Deputy Director of Ambulance Services, and I'll be walking you through today's material. On our agenda for today, we're going to do a brief update from the Office of EMS. We're going to cover some legislative updates from the 2024 session, and we're going to cover changes that the NREMT has made to the National Continued Competency Model. And then we're going to cover some review material. These are things that you, as an education program, should already be compliant with, but we thought it would be good to refresh our memory on some of these processes. So jumping into our Office of EMS transition update, the transition is off to a smooth start. The office went into active status at the beginning of the year, January 1, 2025. We hope the transition has been seamless and you guys have not noticed a disruption to services at all, because that has been our goal. Our new website is also live. You can find that at mn.gov/OEMS. And we've also updated our e-license link. So you can get that updated link on our homepage. There's access to the portal. If you have any bookmarks saved or anything like that, you'll need to update them because that old link will no longer work. Also excited to announce a couple of promotions within the office. I have been promoted from Field Operations Manager to the Deputy Director of Ambulance Services role, and my colleague Patty Forsberg, who was our compliance supervisor, has been promoted to the Deputy Director of EMS Providers. There was a third deputy position created by the legislation, and that's the Deputy Director of Medical Services. That has to be a physician, and we're in the process of filling that position and hope to have an announcement soon. Ambulance aid money. This was a one-time appropriation of money sent out to ambulance services throughout the state. Those payments have been made at the end of last year in 2024. And so that money has all been sent out for ambulance services to use according to the parameters of that program. And we are currently, the program also requires that we make reports to the legislature about how that money is being spent. And so we're currently developing a reporting process, and we'll share that with those folks that need to report how they're spending that money. The legislative session is in full swing and is set to adjourn here at the end of May. There are several EMS-related bills making their way through the legislative process. You can track the status of those by going to our website and following the link to our legislative tracker. There's a number of interesting bills. I invite you to go explore those, and we shall see what happens. It's been an exciting session this year. All right, jumping into our legislative updates that came out of the last session in 2024. Our first update is that the legislature has extended the re-entry grace period for EMRs. Previously, EMRs had a 1-year grace period after they expired, in which they could complete their recertification requirements and renew their certification without having to take an initial course again. They have now extended that grace period to 4 years, so it's matching EMTs, AEMTs, and paramedics. And so the same requirements remain. So within that 4 years, EMRs need to complete a refresher course and a reentry application, and then they can recertify for another 2 years. The expiration date that you receive is going to be dependent on where we are in that 2-year cycle. We also take into account any previous education that's been completed when we're working on assigning that expiration date. For example, we work with EMRs that may have expired a while ago, but attended refresher courses, and maybe they just forgot to submit their applications. We usually will work with those people. If we have proof of education, we can get their certification caught up and back into an active status. If that EMR expires over 4 years ago and their grace period is ended, then those folks will be required to take an EMR initial course again. All right, our next update is the student-instructor ratio for skills days. Previously, the requirement was that you maintained a instructor-to-student ratio of 1:10 when teaching skills, and that was designed to ensure the quality of education and skills being taught. larger groups, you get people that don't participate, and it's tougher for the instructor to monitor those skills. So that 1 to 10, this has been repealed. So this is no longer a requirement. You're not required to have a 1 to 10. We're not going to be tracking it. We're not going to be enforcing it. However, we do recommend that programs continue to follow this 1 to 10 ratio, and that's really to ensure that the quality of that skills education remains high. So please keep that in mind as you're designing your courses. Okay. Next update. The legislature last session also created a reinstatement program for EMTs, AEMTs, paramedics, and community paramedics. This applies to folks that have expired more than 4 years ago, but less than 10. So anybody that expired after January 1, 2014. This allows those folks to get their state certification back by completing the following: completing the renewal education requirements within the last 24 months. They need to obtain a letter of recommendation from an ambulance service medical director, and they need to submit reinstatement applications through the e-license portal. If these 3 requirements are met, then those folks will get their certifications back. And then they'll be back, and they'll be subject to all of the typical renewal requirements. They'll be approved for a new 2 years, and then they'll have to meet the renewal requirements again if they want to maintain it. This program ends on December 31st, 2025. And then after that, it goes back to normal. Folks that expired more than 4 years ago will have to get nationally registered again in order to get their state certification back. The expiration dates assigned through the reinstatement program will depend on when the application has been submitted and when that education has been completed. So for folks that have completed their education between July 1st, 2024, when the program started, and June 30th, 2025, those folks in that window are going to get an expiration date of March 31st, 2027. And then for folks that complete education in the last half of the program, so July 1, 2025 to December 31st, 2025, those folks are going to get an expiration date of March 31st, 2028. Like I mentioned before, once you gain your certification back, you're subject to the same renewal requirements as everybody else going forward. If you're an EMT and you expired before January 1st, 2014, then you're subject to that initial education requirement again. You have to be nationally registered before you can get your Minnesota certification. All right, education program renewal applications have changed. So previously, your applications and payments were due 90 days prior to the program's expiration date. With this new legislation, application and fees are now due 30 days prior to your expiration date. The program coordinators are going to get automated reminder emails from the e-license system at the 90, 60, and 30-day marks. And you'll also be contacted by one of the specialists personally letting you know that it's time to renew. When you get this reminder from the specialist, not only is it a good reminder to start that program application, that's also a good time to work with your specialist to ensure that your roster is up to date, you have the right number of instructors. If there's been any changes to your program coordinator or medical director, we can make sure that the system reflects those before you start that application. This is also a good time to look at your instructor roster and ensure that it's current. Instructors have permissions that allow them to create courses under your program approval. And simply removing them from your roster does not turn off those permissions. That's something that we have to do on the administration side. So if you have changes in personnel and you need to turn on and off those permissions, please let one of your specialists know so that we can do that. We don't want you having any instructors separated from your system, but still creating courses under your program approval. That would be fraudulent. The program renewal fee remains the same. It's $100. If you're paying by paper check, please contact your specialist so that we can, after you submit your application, so we can create an invoice and send that to you. If you're paying by credit card, you can do that as well. We have the credit card portal is online. And if you are a min-state school and you want to pay through the SWIFT system, we can make that happen as well. Just contact your specialist so we can get that electronic SWIFT invoice created and start that process. All right. A new policy that we want to make sure you guys are aware of is if your education program expires for more than 90 days, a specialist is going to come out and review your paperwork and your compliance and conduct an audit prior to us renewing your application. This is to ensure that your program is going to continue to be compliant even though you missed your renewal window. All right. Updates to the NCCP model. The NREMT has updated the model from 2016 when it first came out to this new 2025 model. This chart shows what the breakdown of hours is for each level. And I don't have the comparison up here for 2016 because we are not accepting 2016 hours anymore. And so this new model, this is what you guys need to follow when you're creating your NCCP courses. All right. You'll notice on here that the total number of hours at each level has remained the same. It's just the distribution of the NCCR hours has changed. In some cases, they remain the same, but in most cases, they have changed. So please review this information carefully. Additional information can be found on the NREMT website at nremt.org/document/NCCP. This is the top part of that page. It shows you what the breakdown of those hours is going to be. The rest of this document talks about the various courses, like the alphabet courses, PALS, ACLS, PHTLS, and how they can be used to distribute it into your education for the NREMT. So please check out this information for if you have additional questions. All right. We've updated our education program compliance manual. So that was that was created in like 2016. It's needed to have some updates and revisions. That is complete and it is available on our new website. So please throw out any old versions of the compliance manual you have and you can download a new version of it from our website. All right. So that takes care of our new information. I'd like to transition now into going over some just some review of how to do your initial course notifications in the system. Most program coordinators should be familiar with this process, but we wanted to refresh it in your minds, especially for initial courses. Because in Minnesota, we require that people are registered with the NREMT before gaining their initial certification. We've noticed a drop off in the number of initial courses being entered into the system. And just as a reminder, the NREMT accepts state EMS office approved education for initial courses, and that approval from the state office is obtained by submitting your courses in the e-license system. If you were ever to be audited by the NREMT and they wanted proof that you had state approval for your course and we don't have this listing with the approved date on there, then they could reject that course. So it's important that not only to be compliant with state law that you're entering all courses, but also to make sure that folks are getting credit and candidates are getting credit for that course as well. All right, so what does that process look like? So you must notify the state EMS office of all initial courses regardless of level. When you create the course, you're going to need to include the following. You're going to need the course type and name, the region, which is the region that your program is located in. The sponsor is just your education program. Location, medical director should pre-populate, and just make sure that all of this information is correct in each field. You'll select an instructor for the course if it's not you. And then that description box can be used for additional information. So we see people use it for all kinds of things. It could be they'll say, oh, this is for, so-and-so fire department, or it'll list out the dates of the course. You can use that description box for whatever you want. However, do be mindful that it is public facing. So when someone searches for courses on the public lookup site, they can see those notes. And so that is a public facing thing. Last, you'll enter a start date, and that should be, and remember, you need to notify us of the start date of a course prior to the course starting. So this start date should be after the date that you create the course. And we will work with you if if something slips and you don't get that course created prior to the course starting. But that is a compliance issue, and we need to know about these courses ahead of time. All right, so once that information is completed, you're going to click save, and then we're going to move on to the credit hours tab. So course lengths. For initial courses, there's a very specific set of course lengths that you need. And the National EMS Education Standards, which are competency-based, they now have a recommended minimum number of course hours to cover all of the content for that level. When we established this system in 2017, we set the minimum number of course hours to the 2016 standards. And these were 40 hours at the EMR level, 120 hours at the EMT level. And for the AEMT and paramedic levels, since you need to be accredited by KHAP, you should follow those standards and guidelines. We don't have a set limit for those or a minimum for those. But for the EMR and the EMT, your course minimums need to be at least 40 and 120. As I mentioned, when the updated version of the National Education Standards was released in 2021, they shifted from an hours-based standard to a competency-based approach. The standards still contain a recommended minimum number of hours, but that's a recommendation and not like an absolute standard. The expectation is that programs document competency rather than just completion of a minimum number of hours. And the way that we recommend documenting competency is through a combination of quizzes, tests, and skills evaluations. The Office of EMS, we're not planning to change the minimum number of hours required at the EMR and EMT level, so continue to use that 40 and 120 respectively when creating courses. All right, so once you submit that course and it gets approved, then you need to add your attendees. And so this is how you're going to be adding your attendees. And we'll just go over this quickly. Step one, you're going to click on the Add Attendee, which is this highlighted button here. This is going to open up a search window, which is the bottom half of the slide here. And you're going to search for your student in this search bar. We recommend using their certification number if they have one. And they can get one by creating an account and starting an application. Because when you have a million Matt Johnsons, you're going to want to use their certification number to search for them, or you might give credit to the wrong attendee. So you're going to search for your attendee here. Their name is going to pop up in this middle section, and you're going to select them and then add them to the course. And then you're going to repeat that step for every student. Right. Let's add course. So you're going to search for them. They're going to show up here. You're going to add them to the course and then repeat steps 1 and 2 until you've added all attendees. All right. When the course is complete, the final step is to enter the attendee's completion and pass-fail status. And the way you do that, without those two pieces of information, the education's not going to populate in the attendee's account, and they may not get their certification approved without that information. To ensure that the applications are approved in a timely manner, you must make sure that these steps have been completed, that you've assigned a completion date and a pass-fail status. We'll walk through it quickly here, but we have a step-by-step document on how to add and manage attendees. So please email your specialist if you'd like to get a copy of that. So to add attendee or manage those attendees, you're going to find your attendees in your list. You can multi-select individual attendees, or you can do this one by one. Your other option is to select this very small box at the top in the gray header bar, and that's going to select all of the attendees in your course. You're going to scroll to the bottom of the screen to the bulk actions button, and then you're going to select that and then select completion date and or attendee status. That's going to open up this pop-up window where you can set the completion date and the status. You click on update, and that will update everybody in your course. Once that's complete, then that proof of that course will show up in that individual's education record, and then the system can approve their applications. All right, so who needs initial course notification? It is everybody at every level. So regardless of the level you're teaching, regardless if they're getting NREMT certified, you need to add those initial courses into the system. So for EMR, EMT, AEMT, paramedic, we need that initial course notification. Ensure that your course hour minimums are correct. Build your roster in eLicense and set that completion date and pass-fail status. All right. Moving on to refreshers. So this next section, we're going to discuss refresher courses and what is expected of education programs to document in the eLicense system. As a reminder, the NREMT requires refresher education be approved by state EMS offices to be eligible for their renewal process. And refresher education gets approved by programs submitting the course through the eLicense system, where we then review and approve those courses. Your blanket 2-year program approval does not meet this requirement, and each course must be submitted and approved in order to be qualifying for this education. So this is important. If an applicant undergoes an audit from either our office or the NREMT, we need to make sure that we have that tracked. We're going to break this next section down by certification level and touch on what is required from each program versus what attendees are responsible for. So starting with EMRs. So EMRs refresher courses can be submitted as either the NCCP renewal topic or as a refresher course type. So that's just like your traditional 16-hour refresher course. Statute does not allow EMRs to use continuing education hours like the other certification levels. EMRs can only renew through the 16-hour refresher course or the NCCP model. If your program submits courses as a 16-hour refresher, it means you're not held to the category hour requirements of the NCCP model. The refresher course allows you to customize your refresher content to whomever you may be providing that education to. The 16-hour method also gives your program a lot of freedom in developing course content. If you have specific questions about what is allowed, please reach out to your specialist for clarification. So that's the 16-hour refresher course. If your program is teaching the NCCP renewal topics, the education program is responsible to provide the 8 NCCR hours as a minimum, and they need to be entered in the distribution pattern that is laid out by the NREMT. You should explicitly let your students know if you're going to be providing them with the ICCR and LCCR hours, or if the attendee is going to be responsible for adding those hours to their record. As the education program, if you want to go above and beyond and provide that full 16-hour NCCP course, you can certainly do that. Just make sure you're being clear with your attendees who's responsible for what. All right. You're going to see this refresher slide a couple of times here, just as a reminder, just to kind of reinforce that even at the refresher courses, for no matter what it is, we need that course notification by creating that course in the eLicense system. Ensure your hours are correct and that your distributions are matching the 2025 NCCP model. Build your roster out, set those completion dates and pass-fail statuses. All right, moving on to EMT refreshers. So EMTs are allowed to renew their certification using multiple methods. The 2 methods that education programs have a direct connection to are the 24-hour EMT refresher course and the 40-hour NCCP model. The 24-hour refresher is for state certified EMTs only, and it's not going to satisfy requirements at the NREMT level. And it's important that both you and the individual know that the 24-hour model is only for state certifications. And so the education program is responsible to build and give credit for those 24-hour courses in the system. All right, so this next part is important and could potentially change the process in which programs enter your education in the system. State law requires education programs notify the state office prior to the start date of any EMS education courses. Because Minnesota accepts the National Registry and many of our providers maintain their registration with the NREMT, we found that programs are drifting away from entering their courses into the state system and only checking people off on the NREMT side. However, you are still required to create your courses in the state e-license system. So this is to comply with the state law. Ensure your course is state approved and accepted by the NREMT, and it can help prevent any delays in recertification if the NREMT were to audit that candidate. If a candidate has education in their state record, we can renew their state certification before their NREMT renews, and this is going to prevent any delays or lapse in that person's certification where they may be ineligible to work. So this is why it's super important with the NCCP topics to be entering them into both systems. You're going to have to track it in the NREMT side if you need to do it that way, but you have to create it into the state system as well. So please don't forget to do that. All right. Just like the EMRs, just like for EMTs, with the refresher course or a renewal course, make sure you're doing the course notification by creating that course in our system ahead of time. Put in the appropriate course hours, build your roster, set your completion dates, set your pass-fail status. All right. And finally, moving on to AEMTs and paramedic refresher courses. Paramedics and AEMTs have fewer recertification options than EMTs. They are only able to complete the NCCP renewal method. And this is where it intersects with education programs. Paramedics and AEMTs can recertify with continuing education, but this is where your education program will have some responsibility. So they must complete the NCCP renewal method and to renew either their state or their NREMT certification. So just like with EMTs, you have to create your courses in the e-license system. Make sure you're using the correct NCCR hour breakdown according to the 2025 guidelines. And again, like with the EMRs, you're going to want to clarify for these folks, are you providing all 60 hours, 35 or 60 hours appropriate? I can't remember what it was for AEMT. But are you providing them all of those hours, or are you just providing the NCCR hours, and that the individual will have to make up the rest for their LCCR and ICCR content? So just be clear on that. And again, NCCP renewal is the only method for AEMT and paramedic. Please make sure you're building all of those courses into the system, adding your course hours, creating that roster, and setting those completion dates and pass-fail statuses. All right. As a recap, refresher courses can be used by everyone to recertify. Only EMTs, AEMTs, and paramedics are allowed to recertify via continuing education. So refresher courses, that's going to be like your 16-hour, your 24-hour, or the NCCP courses. Continuing education credits is a much broader umbrella. EMTs, AEMTs, and paramedics can take 48 hours of continuing education. So that's anything that they get that's EMS related. They can upload that into their e-license account. And when they hit 48 hours, that can be used to recertify their state certification. Continuing education can be obtained through a variety of methods. It doesn't have to be necessarily through a state-approved program. It can include conferences, online modules, CPR refresher courses can be used, your ACLS refresher, any of those alphabet classes, those can be used as part of that 48 hours of continuing education. Just for your awareness, we have seen a number of individuals complete NCCR hours through online vendors that are not approved by the Office of EMS. Unfortunately, those NCCR hours completed through those vendors cannot be applied to the NCCP model for state certification, even though they may be accepted by the NREMT. We've then had to work with those individuals to take those hours, add them as continuing education, and then they have to make up that additional 8 hours, to hit that 48-hour requirement for EMTs. This usually means needing to complete an additional 8 hours to reach the 48 hours. So that's just for your awareness piece. You have no control over that, but a lot of the online vendors are not state approved and cannot be used towards the NCCP model and have to be used towards that continuing education model for someone's state certification. All right, community EMTs and paramedics. So when it comes to these two special categories, education programs are required to create the initial courses in the e-license system. When it comes time to renew their certifications, community EMTs and paramedics will renew their base certification first, and then their community status after will open up for them. Although this may be changing come July, we are updating our application so that these will all be in one application. And it'll just be a seamless process to renew everything all at once. But for now, it's a two-step process. Community EMTs have no additional continuing education requirements right now, although this may change with certain bills in the legislature. Community paramedics, however, need to add 12 hours of medical director approved community paramedic education to their record in order to maintain their community paramedic license. All right. All right, moving on to the EMT exam process. So everybody should be familiar with this. This has not changed since 2016. And so we're just going to do a quick, dirty review of what you need to do and how to run an EMT psychomotor exam. Obviously, if you have any questions, please reach out to our office and we'd be happy to walk you through those processes. All right, so nothing has changed here. So this is just a quick reminder. Step 1, you're going to submit the EMT exam request form. So you'll complete the top portion of the form with the exam date, the approved agent, medical director, etc. You do not need to list your examiners on the form when you submit it for approval. We know that it can be hard to pin down examiners and that things happen at the last minute and you might have to make changes. And so that's fine if you don't know your examiners ahead of time. However, we want to ensure that you're using approved examiners. So make sure you're checking the Office of EMS website to make sure that you're using that they have that approved examiner status on their certification. Because if you are not following the process and you used unapproved examiners, we do reserve the right to nullify results of those exams that are not following the process. When the exam is approved by a specialist, we'll return the exam form back to you and we'll have added an exam ID for tracking purposes on our side. We'll also send you a blank roster for your approved agent to record results on during the exam. Step 3, when the exam is done, you're going to return the completed exam request form, making sure to list all examiner used, as well as the exam roster to your specialist for recording. Again, remember, if an examiner or an approved agent is found to not be approved for that role, we do reserve the right to nullify the entire exam for all candidates. So, we don't want to punish anybody and we try to be reasonable, but we do need to follow these processes to ensure fair exams, and we will enforce it and nullify results if those processes are not being followed. If you have any questions about any of this and you want to follow up with your specialist, please reach out so that they can give you a more in-depth briefing. All right, so how does somebody become an approved examiner or an approved agent? So the qualifications for both approved agents and examiners are the same. You have to be state certified at or above the level you're examining, in this case, EMT or higher, and you have to have a current CPR card. To be an examiner, you must also watch a Scoring Best Practices webinar and submit the appropriate application. Approved agents must also watch the webinar and submit an application, but they also need a medical director's signature, and they have to attend additional training on the responsibilities of an approved agent with an EMS specialist. So approved agent is a step above that examiner and requires a couple additional verifications as well as additional training to serve in the role as an approved agent. And then just to reiterate, this is very important. The state EMS office reserves the right to nullify an exam for all candidates present if the approved agent and or any of the examiners is found to not be approved for that role prior to the exam. We also will work with the NREMT to ensure that candidates are not receiving credit for their completing a state-approved skills evaluation as well. So that will hang up their certification process. In an aim to be reasonable, if you do find yourself in a pinch, please reach out to your specialist and they can help with some just-in-time training for an approved agent, or we can help troubleshoot another solution and maybe connect you with someone else. We prefer early intervention, so please don't hesitate to reach out to us. All right. So just some real quick questions we had. These are FAQs that often come up from education programs. And so we'll just go through these 5 questions quick. So number one, who's required to have a background study? We get this question a lot. Um, Minnesota state law requires that anyone providing patient care in specific licensed facilities go through a Department of Human Services net study background check. These facilities are specifically named in statute, and they include but aren't limited to hospitals, clinics, nursing homes, and there's a few others. Ambulance services are not on the list and do not require a net study background check for individual students that are going to provide patient care. However, individual agencies and facilities may have their own policies. So work with your clinical sites to figure out what needs to happen regarding background checks, as it can vary from site to site. But if you send your EMT students to an ambulance service, the state does not require that they have a background check. All right. Number 2, are FEMA courses required? So FEMA courses are not specifically named in the 2021 National EMS Education Standards. However, and these FEMA courses that we're talking about are the independent study courses about the National Incident Management System, the IS 100, 200, 300, or 100, 200, and 700 courses. So again, they're not specifically called out in the 2021 education standards. However, they can meet the learning objectives about incident command and incident management from the education standards. So if your program wants to incorporate the independent study courses into your curriculum, you're more than welcome to do so. It's just not specifically required anymore. They used to be in old versions of the standards, but it's no longer specifically named. All right, question 3. My program provides education to hundreds of people or multiple agencies. Do I need to submit a course for every class, or can I submit one course and add all providers to that course at the end of the cycle? Believe it or not, this is a question we get a lot. It is a complicated question, and there are many different ways to build your courses into the system and how to track your records. So for this one, I'm not going to go into too much depth. I'm going to punt it to the specialists. So if you have questions about how to structure your courses or to maintain your records, please reach out to your specialist to discuss the best strategy for your program, because what works for you may not work for somebody else, or what works for somebody else may not work for you. So it's really important that we can certainly help you come up with the best way to be working the most efficiently within the system. So number 4, is there a way for providers to enter their education outside of the renewal application? There is. So we have instructions for adding education to the new My Report feature that's in everybody's e-license account. Reach out to your specialist for a copy of the directions, and then you can distribute them to your students. But this is a way where, rather than waiting for credit to be assigned, at the application point, to have to sit there and spend hours ending your education. Every time I attend a course at a conference or something, I can add that to my education record, and it'll just be in there in perpetuity. So it's a great way to maintain those records. Number 5, is there a minimum age for certification with the NREMT and/or the state? A very common question that we get. I think most people end up shocked that there is no longer an age limit at the NREMT. In June of 2020, they removed their age requirement for testing and registration as an EMT. In the state of Minnesota, does not have an age limit in statute. There are some limiting factors, like having a driver's license in order to drive an ambulance if you're going to work on an ambulance as an EMT. And obviously going to paramedic school requires enrollment at a college or university. So there's some normal age barriers along the way. Some insurance companies and employers may also have their own requirements. But as far as the NREMT is concerned and the state, we do not have an age limit on who can qualify to become an EMT. All right. Well, thank you for watching our education program update webinar. If you have further questions, feel free to reach out to me or one of the specialists at their emails on this slide. And that is all that we have for you today. Thank you, goodbye, and have a good day. Bye-bye.